If you're over 50 and you've been told that sciatic pain is just something you have to live with, that it's a normal part of aging, or that rest and painkillers are your only real options, then I want you to stay with me very closely for the next few minutes, because that belief is one of the biggest reasons sciatic pain becomes chronic and keeps coming back. The truth is, most sciatic pain in adults over 50 is not caused by irreversible damage, and it's not a life sentence. In many cases, it's caused by stiffness, weakness, and poor movement patterns that quietly build up over years, and the right kind of movement can start calming that irritated nerve far faster than you might expect. Today, I'm going to show you 4 safe, simple exercises specifically chosen for people over 50 that can help relieve sciatic pain by reducing nerve pressure, improving circulation, and restoring natural mobility. And I'll also explain exactly why they work and what mistakes to avoid so you don't accidentally make your pain worse. Before we get into the exercises themselves, it's important to quickly understand what sciatic pain really is, because this alone can change how you approach your body. The sciatic nerve is the largest nerve in your body. It starts in your lower back, travels through your hips and buttocks, and runs all the way down each leg. When that nerve gets irritated or compressed, you may feel sharp pain, burning, tingling, numbness, or an aching sensation that shoots down one side of your body. For people over 50, the most common reasons this happens are stiff hips, tight glute muscles, reduced spinal mobility, weak deep core muscles, and prolonged sitting. Notice that I didn't say you're old or your spine is worn out. What actually happens is that the tissues around the nerve lose their ability to move and glide smoothly, and that creates pressure and inflammation. The goal of the exercises you're about to learn is not to force anything, not to stretch aggressively, and not to push through pain, but to gently restore space, movement, and blood flow around that nerve so it can calm down. One of the biggest mistakes people over 50 make with sciatic pain is either doing nothing out of fear or doing exercises that are too intense, too fast, or designed for much younger bodies. Pain is not a signal that you're broken, it's a signal that your nervous system feels threatened. When you move in a slow, controlled, and confident way, you send the opposite message to your brain, and that's when real relief begins. As we go through these 4 exercises, remember this simple rule. You should feel gentle effort and mild stretching, but never sharp pain, burning, or worsening symptoms down the leg. If you do, you ease off. This is about consistency, not intensity. The first exercise focuses on restoring gentle mobility to your lower back and hips, which is essential for reducing pressure on the sciatic nerve. Many people over 50 spend hours sitting, and over time, the lower spine becomes stiff and compressed. When the spine doesn't move well, the nerve becomes more sensitive. For this movement, you can do it on a firm bed, a mat on the floor, or even a carpet. You'll lie on your back with your knees bent and your feet flat. From here, you slowly bring one knee toward your chest, using your hands behind the thigh or over the knee, whichever feels more comfortable. As you do this, you gently exhale and allow your lower back to relax into the surface beneath you. You hold for a few seconds, then slowly return the foot to the floor and switch sides. This simple movement helps decompress the lower spine and encourages the nerve to glide rather than stay stuck. As you alternate sides, you may notice one side feels tighter or more restricted, and that's very common. You don't force it. You simply breathe, move slowly, and let your body adapt. Over time, this gentle knee-to-chest motion can significantly reduce stiffness that contributes to sciatic pain. As you continue this movement, you can progress by bringing both knees toward your chest at the same time if it feels comfortable. You gently wrap your arms around your legs, rock very slightly side to side, and focus on relaxing your jaw, shoulders, and neck. This is not about pulling hard, it's about giving your nervous system a sense of safety. Many people are surprised that something so gentle can create noticeable relief, but remember, sciatic pain is often more about sensitivity than damage. After about 1 to 2 minutes of slow, controlled movement here, you're ready to move on. The second exercise addresses one of the most common and overlooked contributors to sciatic pain in people over 50, tight glute and hip muscles, especially a deep muscle called the piriformis that sits very close to the sciatic nerve. When this muscle becomes tight, it can compress the nerve and send pain down the leg. To work on this safely, you'll stay on your back with both knees bent and feet flat. You place the ankle of one leg over the opposite knee, forming a figure 4 shape. If this already feels like a stretch, you may stay right there. If it feels comfortable, you gently bring the bottom leg toward your chest, holding behind the thigh. You should feel a stretch deep in the hip and buttock, not in the knee. If you feel knee discomfort, you reduce the range or come out of the position. You breathe slowly, holding this position for about 20 to 30 seconds, then slowly release and switch sides. What makes this exercise so effective is that it targets a muscle that often becomes shortened from years of sitting and limited movement. As that muscle relaxes, it creates more space for the sciatic nerve. Over time, this can reduce the sharp shooting sensations many people experience. One important thing to avoid here is bouncing or pulling aggressively. That can irritate the nerve. Gentle, steady pressure combined with slow breathing is what tells your body it's safe to let go. After opening up the hips, the next step is to improve circulation and nerve mobility down the leg itself. Sciatic pain is not just about compression, it's also about how well the nerve can move and receive blood flow. The third exercise is a gentle nerve gliding movement designed specifically for people over 50. You can do this seated in a chair or on the edge of your bed. You sit tall, with both feet flat on the floor. Slowly extend one leg forward so the knee straightens, and as you do, gently lift your toes toward you. At the same time, you keep your chest lifted and your spine neutral. You should feel a mild stretch along the back of the leg, not pain. Then you slowly bend the knee and return the foot to the floor. You repeat this movement in a slow, controlled manner about 8 to 10 times, then switch sides. What makes this exercise so effective is that it targets the sciatic nerve itself, encouraging it to glide smoothly through the surrounding tissues instead of being stuck in one position. Think of it like gently flossing the nerve. This kind of movement can reduce tingling, numbness, and that pulling sensation many people feel behind the thigh or knee. The key is smooth, rhythmic motion. If you feel increased pain shooting down the leg, you're going too far. You reduce the range and keep it comfortable. Over time, this exercise can dramatically improve how your leg feels during walking and daily activities. Now that we've addressed mobility and nerve movement, the final exercise focuses on something absolutely critical for long-term relief: strengthening the muscles that support your spine and hips. Weak support muscles means your body relies on passive structures like joints and nerves, which increases irritation. The good news is you don't need intense workouts or floor exercises that feel intimidating. This movement is simple, safe, and very effective for people over 50. You can do it lying on your back with knees bent and feet hip-width apart. From this position, you gently tighten your abdominal muscles as if you're preparing for a cough, then slowly press through your heels and lift your hips just a few inches off the floor. You're not trying to create a big arch or go as high as possible. You lift only to a comfortable height, hold for a couple of seconds while breathing normally, then slowly lower back down. This activates your glutes, lower back, and deep core muscles, which help stabilize the spine and reduce stress on the sciatic nerve. As these muscles get stronger, everyday movements like standing up, walking, and climbing stairs become easier and less painful. You might start with 5 to 8 repetitions and gradually build up as you feel stronger. One common mistake here is holding your breath or pushing through pain. Keep your breathing steady and your movements controlled. As you put these 4 exercises together, what you're really doing is creating a complete system for sciatic pain relief. You're reducing stiffness in the spine, releasing tight hip muscles, improving nerve mobility, and strengthening supportive muscles. This combination is far more effective than doing random stretches or relying on medication alone. Consistency is the secret. Doing these exercises once won't fix everything, but doing them most days, even for 10 to 15 minutes, can lead to meaningful improvement over time. There are also a few important things to avoid if you're serious about relieving sciatic pain. Avoid sitting for long periods without movement. Even standing up and walking for a minute every half hour can make a difference. Avoid aggressive stretching that causes sharp pain. More is not better when it comes to nerves. And avoid the mindset that pain means you should stop moving entirely.
Safe, gentle movement is often the solution, not the problem.
It's also worth mentioning that progress is not always linear. Some days will feel better than others, especially in the beginning. That doesn't mean the exercises aren't working. Your nervous system is learning to trust movement again, and that takes time. Pay attention to small improvements, like being able to walk a little farther, sleep more comfortably, or stand up with less stiffness. Those are signs you're on the right track. As we come to the end, let's quickly recap. Sciatic pain over 50 is often caused by stiffness, muscle tightness, poor circulation, and weakness, not just aging or damage. Gentle spinal mobility, hip release, nerve gliding, and basic strengthening can significantly reduce pressure on the sciatic nerve and calm pain. When done consistently and carefully, these 4 exercises can help you move with more confidence and less discomfort. As you continue practicing these movements, it's important to understand how to fit them into real life, because the biggest difference between people who get relief and people who stay stuck in pain is not the exercises themselves, but how they're used day after day. Many people over 50 do a set of exercises once, feel a little better, and then stop when life gets busy or when the pain eases slightly. What actually brings lasting relief is turning these movements into part of your routine, just like brushing your teeth. The sciatic nerve responds best to regular, gentle input. Even 5 to 10 minutes in the morning and again later in the day can help keep the nerve calm and mobile. Think of these exercises as maintenance for your nervous system, not a temporary fix. One question I hear all the time is, when is the best time of day to do these exercises? The answer depends on your symptoms, but there are some general guidelines that work well for most people over 50. If your sciatic pain is worst in the morning, your tissues are likely stiff from staying in one position overnight. Doing the gentle knee-to-chest movement and the hip stretch soon after you wake up can help loosen things up and make walking and standing feel easier. If your pain builds throughout the day, especially after sitting, the nerve gliding movement and the strengthening exercise later in the day can be very helpful. You don't need to do all 4 exercises every single time. You can rotate them, focusing on what your body needs most that day. Another key factor in sciatic pain relief is how you move outside of exercise time. Many people unknowingly keep irritating the nerve through everyday habits. One common issue is how you sit. Sitting with your wallet in your back pocket, crossing your legs for long periods, or slouching with your lower back rounded can all increase pressure on the sciatic nerve. Try to sit with both feet flat on the floor, your hips slightly higher than your knees, and your lower back supported. If you're watching television or using a computer, set a timer to remind yourself to stand up and move every 30 to 40 minutes. These small changes can dramatically reduce flare-ups. Walking is another powerful but often overlooked tool for sciatic pain relief, especially for people over 50. Walking encourages natural movement of the hips and spine and improves circulation to the nerve. You don't need to walk fast or far. A comfortable, relaxed pace is perfect. If you notice that one leg feels tight or heavy, that's a sign to slow down and focus on posture. Keep your head tall, shoulders relaxed, and arms swinging naturally. Even short walks done consistently can support the benefits of the exercises you're doing. It's also important to talk about flare-ups because almost everyone experiences them at some point. A flare-up does not mean you've damaged something or undone your progress. It simply means the nerve has become more sensitive. When this happens, the worst thing you can do is panic and stop all movement. Instead, you scale back. You reduce the range of motion, slow everything down, and focus on breathing. Gentle movements like the knee-to-chest exercise and slow nerve glides can actually calm a flare-up when done carefully. You listen to your body without becoming afraid of it. Breathing plays a much bigger role in sciatic pain than most people realize. When you're stressed, anxious, or frustrated by pain, your nervous system stays on high alert. This increases muscle tension and sensitivity around the nerve. During each exercise, make a conscious effort to breathe slowly through your nose and out through your mouth. Long, relaxed exhalations tell your brain that it's safe to let go of tension. This can reduce pain even before physical changes occur. You're not just training muscles, you're training your nervous system. Another question that often comes up is whether you should use heat or ice along with these exercises. In general, heat can be very helpful for stiffness and tight muscles, especially before movement. A warm shower or heating pad for 10 to 15 minutes can make the exercises feel easier and more comfortable. Ice can be useful if you're dealing with sharp inflammation after a flare-up, but it should be used cautiously and for short periods. The goal is to support movement, not replace it. If you're wondering how long it takes to see results, the answer varies, but many people over 50 notice small improvements within 1 to 2 weeks of consistent practice. These improvements might show up as less intense pain, fewer flare-ups, or better mobility rather than complete relief right away. That's normal. Nerves take time to calm down and heal. The key is to focus on progress, not perfection. Even a 20% improvement is a sign that you're moving in the right direction. It's also important to know when to seek additional help. If your sciatic pain is accompanied by severe weakness, loss of bladder or bowel control, or pain that continues to worsen despite gentle movement, you should consult a healthcare professional. These exercises are designed for typical age-related sciatic pain, not emergency conditions. Working with a physical therapist who understands nerve pain and aging bodies can be very beneficial. One of the most empowering things you can do is change how you think about your body. Many people over 50 have been told for years that their pain is simply due to wear and tear. While changes do occur with age, your body is still incredibly adaptable. Muscles can strengthen, joints can move better, and nerves can become less sensitive at any age. When you approach movement with patience and confidence, you give your body the chance to respond positively. As you continue on this journey, remember that consistency beats intensity every time. Gentle, regular movement sends a powerful message to your nervous system that it's safe to move. Over time, that message becomes stronger and pain loses its grip on your daily life. You're not trying to force your body to change overnight. You're giving it the right signals day after day so it can heal at its own pace. To bring everything together, sciatic pain over 50 is often the result of stiffness, tight hips, reduced nerve mobility, and weak support muscles rather than irreversible damage. By practicing gentle spinal mobility, releasing tight muscles, improving nerve movement, strengthening supportive muscles, and making small daily habit changes, you can significantly reduce discomfort and regain confidence in your movement. If you found this information helpful, make sure to subscribe to the channel, like this video, and share it with someone who might be struggling with sciatic pain, and let me know in the comments what topic you'd like to see covered next.